In this video, we'll discuss about PT or INR test. PT means prothrombin time. INR means international normalized ratio. So PT INR test, prothrombin time and international normalized ratio test. Whenever if the person has injury, whenever the person has injured, bleeding occur. However, after few second times, the bleeding stop. The reason behind is whenever the injury has occurred, the platelet as well as the clotting factor arrived at the site of that injury and they form a clot. This time is called as prothrombin time. That is time taken to clot. Time taken to clot, the blood clot is called as prothrombin time. In normal healthy individual, the prothrombin time 10 to 15 seconds, whereas people taking anticoagulant medicine, the prothrombin time 22 to 35 seconds. If that prothrombin time is greater than 60 seconds, then we considered as critical value, and these people will consult doctor. So normal prothrombin time 10 to 15 seconds. That people using anticoagulant or blood thinner like aspirin, warfarin and coumarin. So aspirin, warfarin, coumarin, like this blood thinner anticoagulant means 22 to 35 seconds. More than 60 to 65 seconds considered as critical value, they consult doctor. Now we'll see with INR. INR means International Normalized Ratio. Generally, to calculate the prothrombin time, different laboratory uses different reagent, which leads to different result. To normalize or to standardize that value, this INR came into existence. In healthy individual, that normal INR 0.9 to 1.3. In healthy individual, normal INR 0.9 to 1.3. Whereas people taking anticoagulant medicine, the INR range from 2 to 3. If that INR value is greater than 5 or 5.5, we considered as high risk of bleeding. And if INR value are less than 0.5, then the person has high chances having blood clot. Most importantly, the INR value are only useful to adjust the dosage of medicine. So, the INR value are only useful to adjust the dosage of medicine. That is, using INR value, the doctor can determine how this medicine are working and how this effective to prevent blood clot. For example, for a patient taking anticoagulant medicine, this INR value is 4. More than that normal INR value, then the person have high risk of bleeding. So dosage should be reduced. So what is the main use of INR value? Doctor can determine how these medicine are working, how this effective to prevent blood clot. So for patient taking anticoagulant medicine, that INR value is 4. more than the normal value, then the person have high risk of bleeding. So dosage should be reduced. In the same way, if that INR value is less than normal, so less than normal, then dosage of anticoagulant medicine is increased. So most importantly, INR are generally used for that adjustment of dosage. So generally used for adjustment of dosage in that blood thinning medication patient. Next, who should get this test done? Generally, the people with anticoagulant or blood thinning medicine like aspirin, warfarin, coumarin, and that people with prolonged bleeding, excessive bleeding, bleeding in gum, nose bleeding, then menstrual bleeding, and also before surgery. This one of the routine test to be done. So who should get this test? People using anticoagulant or blood thinning medicine, prolonged bleeding, excessive bleeding, bleeding in gum, bleeding in nose, then menstrual bleeding before surgery. This one of the routine test to be done. So this is simple blood test where blood sample is collected from the vein. This one is the simple blood test. From vein we collected blood sample and the blood sample sent to that laboratory to assess PT-INR value. The cost of this test approximately 100 to 200 rupees only. Simple way of blood collection. Collect vein blood sample sent to that laboratory, cost also 100 to 200 rupees only. And most importantly, before undergoing the PT-INR test, the person should avoid taking alcohol, beef, pork, green tea and green leafy vegetables. The reason what is the reason behind is these ingredients are loaded with vitamin K. These are the food material containing vitamin K, which may give a wrong interpretation. It chances for wrong result. So next, what condition PT-INR value are increased? What is the condition? As prothrombin is synthesized in liver. So in our liver only synthesizing that prothrombin. Any problem associated with liver may lead to prothrombin time increased. So prothrombin is synthesized in our liver. Any problem associated with this one leads to increasing PT time. Also, people with vitamin K deficiency, the coagulation factor 7 deficiency in condition with disseminated intravascular coagulation condition with T vein thrombosis, then arterial fibrillation, heart related problems. These condition the PT time will be increased. What are the condition PT and INR value increase? Any problem with liver, vitamin K deficiency, then coagulation factor 7 deficiency, then disseminated intravascular coagulation condition, T vein thrombosis, then arterial fibrillation, heart related problem. So this is all about PT-INR test. Thanks for watching.